Hello, this is Ellen Madono speaking to you from Tokyo Homeopathy. My project is to get you started doing real cases as soon as possible, but there's some things that you might want to know beforehand, and one of them might be how to deal with your own anxiety and the anxiety of your patients. Actually, anxiety is something I know a lot about because I feel a lot of anxiety. I'm trying to give my patients the best service I possibly can. It's not always as obvious as you would think it would be. And of course, my patients are anxious also because they are meeting me for the first time, if this is the first interview. I accept this anxiety. It's just the way things are. I also need to think about what's happening and how can I best deal with the reality of life as a homeopath or as a patient. I assume that you are not anxious in exactly the same way that I am, but it's useful to sometimes hear how other people deal with this situation. This is our path today. I'm going to look at first our talkative patients and then at anxious patients. And finally, hypochondriacal patients. Then I'll look at myself. If I wrote down every word, I would be a hot, sweaty mess. And I'm not sure that I would be able to understand the patient very well because I would be too focused on the writing of the notes. We're going to be talking about note-taking next. But for the minute, let's think about the talkative patient. Very nice patients are very talkative, and I'm more than happy to listen because there's nothing particularly helpful about asking too many questions. Often patients tell you as much as you need to know, but there's a time frame. People get tired after talking too long, so there is some necessity to be directive, but we're going to talk about that later. For the moment, it's these talkative patients, and they could just be very open. And this is just a time for us homeopaths to listen. What happens when the patient is actually anxious? This is another condition. Many patients who are talking a lot are actually hiding behind their words. It's very normal. In this case, we need to be like these deer and have very open ears, ready to just take in what we observe and hear. I'm kind of like this myself. One small little detail of my life is not quite in order, and I become anxious. Patients are also like that. It's fairly normal, I think. You don't have to be very sick to be like that. So when we're on our path, we meet patients who are actually quite upset by these small details. And I'd like to talk about these patients because they're not quite as simple as the simple open patient. These patients have looked up their problems on the internet and have found all kinds of answers. By the time they're talking to you, their investigations have made them even more anxious than they were to begin with. And they have endless disease possibilities. When they think of their ancestors, they can see that their ancestors had all kinds of diseases. So do they have the same DNA? Actually, homeopaths think about that too. It's not an odd thing to be thinking about. It's just the amount of anxiety that goes into this thinking. you slowly discover that these anxious patients are actually shopping for doctors. I remember George Vithoulkas told a story about a man who gave him a very hard time treating him. When the remedy worked, the man sighed a sigh of relief to tell them that he actually had cancer. But he hadn't told George this. Or maybe it wasn't cancer, but it was something very, very severe. And he hadn't told George this. He was just testing him. This is something that occurs often. Why are they so hard to treat? They're so smart and intellectual. But that isn't the problem in itself. The problem is they are only tuned in to what they think. They are not tuned in to what they feel. They come to us with many gadgets and a handful of lab data. And as soon as something happens, they run out for a test, a new test, and they're watching every number because this thinking part of their existence is very well developed. But when you ask them how they feel, what happened, how did it feel physically, they can't tell you much. For a homeopath, this is actually problematic. It's, of course, a symptom, but it would be much better if they could describe how they feel. But in this situation, you need to have your ears even more open and ready, because actually what they're talking about is sometimes important. Lab numbers, we want to know these numbers. If there's been an improvement, nothing like an objective confirmation that there's been an improvement, especially people who don't feel the changes in their body. This is very important to have these lab tests. But you have to siphon out what is actually going to be important for analyzing the case. Now, I'd like to talk about another subject, that is listening to our own preoccupations. We as homeopaths have our preoccupations. We're not different than our patients. I'm not. Maybe you are. I'd like to talk next about a different kind of patient. This is the withdrawn patient. A very typical example of this is Nat Muir. Nat Muir can be very depressed. It's made from salt. Salt kind of condenses things. It preserves good and bad feelings, in particular when you're depressed. And that's what they focus on. When you talk to a Nat Muir patient, you need to be empathetic. I'm listening. Ooh, that sounds heavy. What did that make you feel? You have to be asking questions that are with them, not directing them. Not something to feed their negativity. Oh, it could be worse. The same thing happened to my friend. What if you try this? Now, this is the one that's really bad for me, because I am so enthusiastic about homeopathy. It worked for me, it's going to work for you. Of course not. That's not what that's not what a Nat Muir wants to hear. A Nat Muir does not want a fix-it man for her emotional life. She doesn't need to have any advice. A person like me needs to be very careful that I stick to empathy. But, I'm not well set up for this recipe. because actually I am like a Nat Muir. I'm very easily feeling negative and depressed because of what somebody said to me, some small thing. And then I shut down. I don't tell anybody else. I don't say anything. I don't like this aspect of myself. And I'm not saying you're like that. What I'm saying is this aspect of me comes out in my consultation. So when I have a Nat Muir, I need to be very, very careful. This is very different from the patients who are not like me. Okay? You know, the clinging child, the person who's clinging to his spouse, the bashful person, the person who's becomes upset when he's in crowds. I'm a little bit like this, but these, I'm trying not to be like that. I've overcome this. I've thrown it away. It's kind of like not an issue. This isn't an issue, but, I don't like crowds. And what about this type? Paranoid, nervous, suspicious. I wouldn't be doing this video seminar if I were like this. So I'm not. But I am more like a Nat Muir. And so this criticism of myself needs to be something that I'm aware of. I'm not going to be able to change the Nat Muir in me tomorrow. I mean, it's pretty natural for me, and no amount of remedies is going to make me into less Nat Muirish. Okay, that just isn't going to happen. Nat Muir doesn't like to be manipulated. Okay? They don't like judgmental people. And actually, many remedies are like this. It's not just Nat Muir. So, it's very important that one becomes reflective about one's difficulties as a homeopath. Getting an objective view of oneself is important. And then reflecting on the difficulties that you have. In my case, I can feel these difficulties in my body. When I relax these feelings, physically, they actually go away. So you can see that by practicing homeopathy, I actually can heal myself. I can become more aware. So this issue of the inner world is not limited to your patient and your understanding of their inner world. It's also a very important part of understanding your own inner world. So when you have difficulties with your patients, my advice is to reflect on it and see it as something that's going to be helpful to you. My difficulties with Nat Muir are certainly of this type. I don't have to take the remedy. I have a patient who's giving me a very clear picture of myself as Nat Muir. I hope you have enjoyed this, and you will press the subscribe button and the ask for notifications when I put up more videos. The intention of this channel is for you to get experience actually doing homeopathy and for you to get reliable results using modern methods. Today has only been an introduction to how I work. I think that all of you have different learning styles. I strongly encourage you to go to my website and see the tutorials that I have up that are really meant for beginners to get them started doing their own cases. Thank you very much. This is Ellen Madono from Tokyo Homeopathy.